teeth whitening or bleaching can be a very predictable treatment to lighten our teeth several shades and to make our teeth shades brighter. But for us to have an effective teeth whitening done, we need to understand what are the causes of discoloration, in which kind of discoloration does teeth whitening works well, and how do we do the teeth whitening process. So we'll look into all these aspects in this video. This is Dr. Arun from Pearls Dentistry, running a dental centers at Chennai Raja Annamalapuram since the year 2001. If you have not subscribed to our channel, please do subscribe to our channel. We've got a whole bunch of videos coming out for you, with respect to dental awareness and dental health education. So when it comes to tooth color, there are several shades of tooth color which varies from person to person. Sometimes tooth to tooth variation will also be there. Tooth can be shades of yellow, shades of greyish tinge, shades of reddish hue also. But what we need to understand is the teeth color is determined by the tooth structure called the dentine, which is the inner layer, and there is an outside enamel which is almost colorless, which reflects the color of the dentine. So based on a genetic pattern, there are different teeth color. Usually there is a spectrum of shades which we use to determine the tooth color. For some people, over a period of time, the tooth can get inherently darker. The reason for this is because of the enamel getting worn away or the teeth accumulating stains over a period of time. So there can be an inherent discoloration of teeth, and over a period of time, as the patient's age, the teeth can get darker. So what we need to understand is, once we understand what the base color of the tooth is, then we can, if the patient is not happy, if you're not happy with your tooth color, we can always do a teeth whitening process where we can lighten the tooth color. So that is basically the reason for it. So when we come to discoloration, also that we need to differentiate between what an internal stain is and what an external stain is. External stains are typically stains caused by food, can cause by bacteria, can cause by habits like pan chewing or tobacco or smoking. So external stains, over a period of time, what happens is, so these stains are on the surface of the tooth. Most of the external stains can be effectively removed by getting a teeth cleaning done or a scaling done. So when you get a teeth cleaning or a scaling and a polishing, these external stains can be removed well. Only in certain instances where the patient is a chronic betel nut chewer, a pan chewer, where there is a lot of chemicals that is being released by the constant chewing, has got into the tooth structure, where the tooth itself discolored over a period of time by developing multiple cracks on the tooth structure. So in that case, there is not only external stain, but these stains have gone into the inside of the tooth structure also. Then just a cleaning and a polishing alone will not help. We need to look at something to lighten the tooth structure from the inside itself. So as far as internal stain is concerned, there can be many reasons like fluorosis. There can be hypo or hyper mineralization of the tooth structure. There can be certain genetic conditions like dentinogenesis imperfecta, amelogenesis imperfecta, which can cause changes in the tooth color. There can be, like, as a child, the baby could have got exposed to the tetracycline taken by the mother. So then there can be some discoloration of the tooth structure. These are typically internal stains. So these internal stains will not go by a scaling and a polishing. Definitely we need to take care of it, and then what we do is whitening process. So whitening process, if you look at it, mostly will be reserved for tooth structure that are discolored evenly, or there is a darkening of the tooth color where we need to effectively whiten or lighten the tooth shade. Whitening is very effective. In cases where the tooth is discolored with multiple hues, so sometimes there might be some brown spots and white spot, a mixture of those spots, or it can be like severe tetracycline stains. In these instances, whitening effect will not be predictable. We won't be able to predictably say how much the tooth is going to whiten. You will only have a little betterment from the existing tooth structure. But when it comes to a darkened tooth structure, where we need to lighten it, teeth whitening effectively works very well. There are two kinds of teeth whitening. One is called the in-office procedure, another is called a home procedure. Even though I'm saying a home procedure, it's very important. The home kit is being given by your dentist, and you don't get an over-the-counter procedure because the chemicals can harm your teeth and your gums. So typically what we use in an in-office procedure is usually some form of a peroxide which releases nascent oxygen over a period of time. It gets activated. We can use even laser teeth whitening, where laser activates the oxygen in the peroxide. So this oxygen percolates into the tooth structure and then lightens the teeth from inside. We can usually have several shades whiter teeth by getting a teeth whitening done. So and then for people who want it more whitened, the dentist can give you a home whitening kit also, coupled with an office whitening. You will be able to maintain your white teeth for a very long period of time. Important things to note after whitening is to avoid any colored foods, especially carbonated cola drinks, or having a black coffee or black tea can reverse the effect of whitening and cause again a discoloration of the tooth. Of course, to avoid habits like smoking and pan chewing is very important, otherwise it's going to defeat the purpose of whitening. I hope this video is useful to you. If there are any questions, please do ask in the comment section below. We'll be happy to answer. If you have not subscribed to our channel, please do subscribe to our channel. Until next time, thank you and bye bye.